Good morning, Sarah. My name is Janeska, and I will be your nurse today. Other than being here at the hospital, how is your morning going? Were you able to get any sleep last night? Well, I'm here to try ease any concerns you may have and make this process quick and painless as possible. I'm here to explain to you what will happen today with your procedure and schedule your follow-up. If you have any questions at any point, don't hesitate. Please stop me and ask them. If you need me to explain something a different way in order for you to understand it, or need me to repeat something again, or even slow down, I will. My primary concern is taking care of you the best possible way. So you've been diagnosed with basal cell carcinoma, also known as BCC, on the middle of your zygomatic bone. What that means is you have a tumor in the middle of your cheek. BCC is this type of skin cancer that is common, often caused by UV radiation from the sun or tanning beds that triggers mutation that lead the skin cells of that to rapidly multiply and form tumors that look like an open sore, a red patch, a pink growth, a shiny bump, or a scar. Today, we're removing the tumor. Do you know anything about the procedure we're performing today? Have you had something similar done? No? Well, due to the location and size of your tumor, the dermatologist, Dr. Derm, will be performing a surgical procedure called Mohs micrographic surgery. You will be injected with a local anesthetic. After the area is numb, the dermatologist with a curette, which is a semi-sharp scoop-shaped instrument, will gently scrape the tumor to get a thin layer of tissue that will be carefully examined. After the layer is removed, a drawing of the tissue and its orientation on your face is made as a guide to the exact location of the tumor. The tissue sections are examined for any evidence of remaining cancer cells. If any of the tissue sections show cancerous cells, the process repeats layer by layer until there is no more evidence of the cancer. Once the cancer has been removed, the dermatologist can move to the next phase called reconstruction, where he will stitch up the wound. Now, you may have some feelings about the scarring and possibly disfigurement, but no worries. You are in the best hands. Plus, this procedure has the highest cure rates, best cosmetic results, and the lowest recurrence rates. It is known as the gold standard for treating skin cancer. The procedure takes several hours depending on what is found and how long it takes till we remove the cancer, but after it's done, you're able to go home the exact same day. Now, since you're getting skin tissue removed, there's scarring to be expected. While the procedure overall is a safe treatment, there are possible risks and complications associated with the surgery, which include bleeding, bruising, pain, infection, keloids, which is a raised thick scar, an allergic reaction, and splitting of the stitches. You're at a higher risk in developing this cancer again, and if developed, may require more extensive surgery. That is why I stress to you, it is important that you properly take care of your wound and follow your discharge instructions to prevent any kind of infection. You should make these routine visits to the dermatologist every 6 months for at least 2 years. With that being said, let's schedule your follow-up to remove the stitches. We want to minimize the scarring, and the face heals fairly quickly, so let's say between 5 to 7 days, closer to 5 days. Alright, is there any concerns or questions that I didn't cover or mention that you have before we take you back? If you don't have any questions right now, that's okay. You are more than welcome to ask after the surgery. I'll be more than happy to answer any questions then and throughout your recovery process.